Hi, good morning, Miss Jamaica Sebastian. I am Lynette Pascual, the Program Services Manager here at the Stroke Rehab Services Department. I believe that you're applying as a registered nurse here. So, shall we begin the interview? For the first question, Miss Jamaica Sebastian, can you tell me what qualifications do you have for the position?
As a registered nurse with several years of experience working in a stroke rehab facility, I would exhibit my knowledge and abilities in delivering nursing care to stroke patients, including evaluation, medication administration, wound care, physical therapy teaching, and rehabilitation procedures. These qualifications will, I think, qualify me for the position, ma'am.
Next question, how do you measure success in this role?
As a stroke nurse, success is judged by patient outcomes, such as my capacity to restore function and independence after a stroke and the quality of care offered to patients and their families.
Please describe your work experience as a nurse in a stroke rehabilitation unit and what you learned from it.
Working as a nurse in stroke rehabilitation has given me a lot of knowledge about people who have strokes. As a result of my training, I am now able to provide these people with the full range of care they need as they make their way back to the health.
Consider the possibility that a patient's family has condemned your treatment services. What would you do in this situation?
If a patient's family is dissatisfied with my treatment services, I will first listen to their concerns and attempt to understand their point of view. I would address any particular concerns they may have and present them with detailed explanations of my therapy procedures and the reasoning behind them.
What are the most difficult issues that nurses confront in a stroke rehabilitation care unit?
In a stroke rehab care unit, nurses often confront issues such as managing patients with complicated medical conditions and many comorbidities, maintaining efficient communication between healthcare personnel and patients, and increasing patient independence while ensuring patient safety.
This is going to be my last question for you. Describe a time when you cared for a patient with values, beliefs, or morals that conflicted with your own, and how did the situation affect your relationship with the patient? How does having a diverse workforce benefit the hospital?
I experienced nursing a patient with extremely different ideals and views. This patient's culture valued traditional medicine and rejected Western medicine. Due to our healthcare views, I struggled to connect with the patient. Yet, I learned that I needed to respect their principles and collaborate to develop a solution that met our requirements. To grasp the patient's viewpoint, I learned about their culture, traditional medicine. I also listened to the patient. We created a treatment plan that included Western and traditional medicine via open communication. This experience taught me the significance of culture competence and how each patient has distinct requirements depending on their history, values, and beliefs.